Hello, this is Dr. Evan Osar, co-founder of Massage Therapy Insider and author of the Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. Thank you so much for tuning into Part 4, the final segment of Posture and Movement, improving the massage therapy experience for even greater client results, retention, and revenue. Up to this point, we've discussed our client's strategy. In particular, what strategy are they using to maintain their posture and to move from? Our client's strategy is a plan that their nervous system will utilize to develop their posture and movement. In other words, this is how the nervous system utilizes the myofascial system to organize posture and movement. Our client's history, their hobbies and occupation, as well as their habits, collectively illustrate why they have adopted their specific postural and movement responses, and why they've developed specific muscle imbalances, tightness, and chronic pain syndromes. As manual therapists, we have to know how to accurately assess our clients so that we know where to best direct our treatment, as well as how to best direct their self-care and take-home strategies. That will lead to client success. I'd like to share with you how to put this information into practice so you have a real case scenario of how to apply this information with your client. My client, Debbie, my friend and colleague Ellen is substituting for Debbie for purposes of this presentation, is a 42-year-old mom of 2 children who presented with a chief complaint of back pain, which occurs after sitting at her desk and while lifting her child. She likes to walk and does feel better after a walk as well as after a massage. However, the effects of the massage don't last. The pain is localized to her low back. She has no history of surgery or significant injury. She's been told by her regular massage therapist that she has an anterior pelvic tilt and a tight psoas and erectors that are causing her low back pain. Upon evaluation, I noted a sway back posture, as you can see in the image to the left. I also palpated an anterior femoral head position within the acetabulum. You see me in the middle image. I'm centrating or pulling her hip back underneath her. You can see how that alters her posture and actually aligns her pelvis back up underneath her thorax. I also want to evaluate her psoas length, and you can see me doing that during the modified Thomas test in the image in the far right. Her psoas length is fine. Her upper thigh is parallel to her body. She does, however, have a short rectus femoris, as indicated by her bent knee position. Upon palpation, I noted hypertonic pectoralis minor, anterior abdominal fascia, and very restricted thoracolumbar fascia. We know from research and clinical experience that optimal posture begins with optimal position of the core, or the thoracolpelvic canister. And optimal thoracolpelvic canister alignment and control leads to more optimal movement patterns. Therefore, my first objective was to help Debbie achieve better alignment of her thoracolpelvic canister. In other words, I needed to help Debbie line up her thorax over top her pelvis. In the sway back posture, her trunk is positioned behind her pelvis, and she's overgripping through her thoracolumbar erectors and posterior hip complex. To improve her alignment, I needed to release and lengthen her thoracolumbar fascia, latissimus dorsi, and pectoralis minor. Recall, she was in a sway back posture, so this overstretches the abdominal fascia. So I worked to shorten the anterior abdominal fascia. The soft tissue strategy was very specific since I needed to help Debbie achieve improved thoracolpelvic alignment so that she could breathe properly and activate her deep muscles to enable her to develop a more optimal posture and stabilization strategy post-treatment. The actual technique you use for this strategy is not as important as the actual purpose and the specificity of the techniques that you use and the specific structures that you actually address. Once we had performed the appropriate soft tissue release and our activation work, now it was time to help Debbie improve her breathing, postural, and movement strategies. Since she demonstrated poor control of her core and was a chronic back and hip gripper, common characteristics of the sway back posture, we had to help Debbie adopt a new strategy, otherwise she will leave feeling good and then quickly fall back into her old postural strategies and movement habits. While she was still on the table, I taught her how to develop a better breathing strategy, as we teach in the Postural and Movement Instructor course. This is the first and most important step in improving your client's posture and movement strategy. Along with this, I also had her stop stretching her psoas, since her psoas was not over-lengthened. The psoas is additionally an important back stabilizer. She was actually shutting down her psoas by stretching it, and therefore perpetuating her low back tightness and pain. Next, since Debbie also sits for her job and experiences low back pain after sitting for more than an hour, I taught her how to maintain neutral pelvis and spine position. Optimally aligning her rib cage over top her pelvis was a huge part of her self-care strategy. Finally, I taught her how to bend over and pick up her child while protecting her spine. In other words, I taught her how to bend while using primarily her hips. Recall Debbie was a hip gripper as well. And optimally using her hips is one of the most important strategies for improving how Debbie bended and lifted her child, groceries, or other objects from the floor. By performing an assessment, directing my approach to specifically addressing what I found during my assessment, and then teaching a specific self-care strategy that included breathing, posture, and movement education, I was able to help Debbie decrease her back pain and develop an effective strategy for managing her back pain in the future. Just how effective are these techniques? These are before and after images of a 70-year-old client of one of our students, Karen. By simply applying the strategies we discussed during this webinar, Karen was able to change her client's posture in only one session. What's even more dramatic about these changes, she was able to achieve these changes in only about 10 minutes. And she was able to accomplish them without any manual soft tissue release. 10 minutes and no soft tissue work, and you can see the dramatic changes in the 70-year-old client. Karen was able to accomplish this simply by giving this gentleman a new breathing strategy, a few key movement patterns, and providing him the appropriate cueing, all skills we teach as part of the posture and movement instructor training. You too can achieve these kinds of results and solve many of your clients' chronic postures, tightnesses, and pain syndromes. In fact, imagine the changes that could be made if you added in your soft tissue techniques and skills. How much more dramatic would your results be? How much easier would it be for your clients to accomplish their health and fitness goals? How many more referrals would you get? During this 4-part webinar series, we've identified a key reason for underlying the root cause of your client's tightness, muscle imbalances, and pain. It is the chronic postural movement patterns that have been set up by their medical history, their hobbies and occupation, as well as their chronic habits. You have discovered that if you want to be even more effective at helping your clients achieve their health and fitness goals, you need to improve your awareness of how to identify postural and movement dysfunction and develop the skill set so you know how to institute the most effective strategy. And you know that when you can help your clients accomplish their health and fitness goals, you inspire them and empower them to succeed in other areas of their life. And that's how you move from being successful to being significant, where you leave a lasting impact on your clients' lives. Over the course of these webinars, you have seen the value of improving your clients' posture and movement, and how these improvements can make such a dramatic change to how your clients feel, how they move, as well as to their ability to accomplish their health and fitness goals. We've only scratched the surface as to how valuable this information can be to increasing your effectiveness with your clients. Therefore, I want to share with you an exciting, first-of-its-kind training. You know that you have to differentiate yourself in the marketplace. This is a training to give you the additional strategies to take your business to another level. During Posture and Movement Instructor Level 1 training, the first training designed for the manual therapist that wants to add postural and movement education to the manual therapy work, you will discover exactly how to combine your manual therapy skills with posture and movement education to improve how your clients move and feel in their body. Simply go to Massage Therapy Insider /seminars to discover more information about this event. Why are we offering this training to manual therapists? Because we understand that as a manual therapist, you are in a powerful position to be that expert, that resource your clients need, want, and will pay for. If you want to be that expert, then I strongly encourage you to join us for the very first training of its kind, the Posture and Movement Instructor Level 1 training. I want to thank you for watching this webinar and hope that it has helped you remain informed so you can be that go-to expert. If you found this information useful, feel free to pass it on to your colleagues. This has been Dr. Evan Osar, the Massage Therapy Insider, helping provide you with the tools, techniques, and strategies you need to become that go-to resource your clients rave about, return to, and refer their friends and family to. Take care.